Endometriosis is a condition caused when tissues of the lining of the womb appear anywhere else a part of the lining of the womb. Places such as behind the womb, in the tubes, in the ovaries, on the cover of the bowel, on the bladder, and in the muscles between the vagina and the back passage. It mainly affects the women of reproductive age. It can be quite a complex condition to diagnose, and the incidence of it is 1 in 10 women. It is difficult to define what causes endometriosis. It is believed to be connected with a lining of the womb called endometrium appearing in places where it shouldn't be. So it can be congenital, so it's likely the woman to have it if her mother or sisters, aunties had it. It can be physiological. The thing is, when we have period, the blood is not just coming out through down below. It also, via retrograde route, goes through tubes inside the abdomen, and then it can get embedded anywhere inside the abdomen, behind the womb, on the tubes, on the ovaries. And when it gets embedded, then every next period cycle it starts producing drops of blood, which cause the irritation of the lining of the abdomen, which is responsible for the pain that the condition presents with. The main problems are associated with the pain, primarily during the period. Very often women describe pain that starts a week or so before the period and it lasts through the period. Pain can be there during the intercourse that affects the quality of their personal life. If the condition affects the ovaries, then ovaries can produce so-called chocolate cysts, which can by themselves cause a lot of discomfort during the ovulation and the period as well. If the lesion is located between the vagina and the back passage, then the pain can be associated with opening bowel motions, opening bowels, and very often these women suffer diarrhea and even bleeding during via back passage during their periods. Very complex to diagnose the endometriosis, because if there is no involvement of the ovaries or tubes or any additional organ involvement, endometriosis is not picked up by a blood test or ultrasound test. So the main diagnostic tool of mild to moderate endometriosis is by doing keyhole surgery, so-called laparoscopy, just to identify those spots and lesions by direct vision and be able to stage them as well. If there is endometriosis related ovarian cyst, then that could be picked up on the scan, and they have specific features that enables sonographers to label them as a possible endometriomas. The lesions between the vagina and the back passage identified by deeper modalities of investigation such as MRI, and these are being done before embarking on the surgical options to know exactly where the location is, to be able to retrieve them during the surgery. So the pre-existing main diagnostic tool was keyhole surgery, laparoscopy, but recent NICE guideline recommended consider medical treatment first. So if the symptoms are corrected, there is no further need for laparoscopy to confirm or rule it out. There is no clear evidence of impact of endometriosis on the fertility. If there is an ovarian cyst and it's bigger in size, that may affect the process of ovulation, and the cyst content can also have a toxic effect on a pregnancy itself as well. So in those cases, it is recommended to have those cysts removed to facilitate better conception and better protection for a period to avoid miscarriages. But otherwise, not mild, not moderate, not severe endometriosis is associated with severe, there is a direct correlation between fertility and endometriosis. However, there was an evidence suggesting that treating mild to moderate endometriosis with diathermy may slightly improve the chances of getting pregnant. If symptoms around the period time and taking time off work is becoming a routine, it is advised to consider long-term management with contraceptive, especially the progesterone containing ones that are aimed to eliminate period as it is. And as I mentioned before, it can cause the scarring of the pre-existing lesions, prevent further forming, further adhesions forming, and should allow to get on with the life. There is no cure as such for endometriosis. The long-term treatment and main treatment to support the condition, to allow a woman to get on with her daily life, is considered contraception. So it might not be the cure exactly, but we believe that if we stop the period from happening, those lesions inside the abdomen do not bleed. That causes scarring of the lesions. They become silent, chronic, and they should not cause as much pain and discomfort, neither during period nor during sex. And the way to achieve it mainly is a progesterone-containing contraception, which can come as a pill, as an implant, as an injection, or as a Mirena coil. And the Mirena coil is being one of the popular ones because it's soft and it lasts 5 years.